We're turning now to your health. Glioblastoma, an aggressive and deadly form of brain cancer, is diagnosed in approximately 12,000 people per year. The survival after diagnosis is usually just over a year. Joining me via Zoom this afternoon is Dr. Clark Chin. He is the director of the Brain Tumor Program at Brown University Health. Dr. Chin, thank you so much for joining us this afternoon.
Thank you for having me.
Now, we have seen some pretty high-profile people deal with this diagnosis. Most recently, former U.S. Rep. Mia Love of Utah, who was the first Black Republican elected to Congress. She died last week at the age of just 49. Also, some might recall former Rhode Island Assistant Public Defender Michelle Alves. So tell us a little bit about what glioblastoma is, how it's diagnosed. What are some of the general things that people need to know about this disease?
Well, glioblastoma is the most common form of brain cancer in adults, and it's typically diagnosed when someone presents with symptoms like headache or seizures and ultimately diagnosed on an MRI. Now, I would note that I don't think it's an accident that this disease has taken away many of our societal leaders, the ones you've mentioned, as well as Senator Kennedy, Senator McCain. Based on research that are done in our laboratory as well as in other laboratories, it turns out the same neural transmitters that allows human cognition actually drives the growth of this cancer. And in fact, individuals who've completed 2 years of university education are 20% more likely to develop this disease. And there's an enrichment of this disease in individuals in the higher socioeconomic status. So without understanding, we're beginning to develop drugs that are specifically targeting these various pathways.
Now, you speak about those neurotransmitters kind of being similar in both of those cases. In layman's term, does that mean that people who maybe have more advanced education might be more prone to this? Is there a correlation with this?
There is.
Yes?
There is. There are rather epidemiological studies demonstrating that individuals who've completed 2 years of college education are 20% more likely to develop this disease.
Is there anything that people can do to offset this or prevent it? What can we do in terms of preventative measures by coming into the doctor's offices or taking any steps to keep this at bay?
I think that there's nothing from a lifestyle perspective that can be done as far as we know. However, if there's any symptoms that one's concerned about, if you don't typically have a headache and you all of a sudden have a really bad headache, it's very important to let your primary care physician know so that they could pursue the appropriate workup. As with most cancers, early detection is a key to improving outcome.
Exactly. Talk to us a little bit about the treatment process, which is your expertise. People have actually sought you out because of your expertise in this matter.
Well, the typical process is once we make a diagnosis on MRI, a surgery is performed to remove the tumor maximally while preserving the neurocognitive function of the individual. Once that's done, after 4 to 6 weeks from the surgery, radiation and chemotherapy is given. That's the standard of care.
Okay.
However, we're rapidly changing that standard of care as well. We can now actually implant radiation sources at the time of surgery so that we don't have to wait 4 to 6 weeks before treatment. We have now tools that will allow us to visualize the tumor during surgery so that we could better distinguish where the tumor ends and where the brain begins.
There you
And
go.
so
A very
these are
high
things
level
that
of care coming out of Brown University there. Just quickly, I know we only have like 30 seconds left here, but how many people in this state are able to do what it is that you do?
I think that the Brown University Health is unique in that we have an aggregate of individuals who are dedicated to the disease. So it's not just me here, it's the neuro-oncologists, it's the radiation specialists. We all specialize in this disease. And by coming together, I think we could provide the type of care that very few can match, not just in the state, but in the nation.
Very well said, Dr. Chin. Thank you so much for joining us.